Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
What is considered common healthcare treatments in one culture may not be widely used in another. Here in the United States, many of us stick to what's often called Western medicine. But more and more, some patients are beginning to look for healthcare practices outside Western medicine. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about complementary or integrative medicine. What is it? We'll find out right after this. Stay tuned. Welcome back. This morning we're talking with Dr. Jeff Rausch, a naturopathic doctor, and Dr. Jay Larson, a medical doctor, who are here with us to talk about complementary medicine. Thanks for being here, gentlemen.
You bet.
So Dr. Rausch, let's start with you. You are the owner and medical director at Natural Medicine Plus, where you practice naturopathic medicine. Can you just start by defining what that is?
Yeah, so naturopathic medicine, I would say, it's a whole system approach or whole system philosophy around medicine. So it's not, I like to tell patients or people that it's not just treatment. Oftentimes patients think that what a naturopath does is just dispense natural remedies, and I would say it goes way beyond that. It's really about, part of the philosophy is about encouraging preventative medicine or prevention within health. It's looking at the physiology of the body and trying to correct underlying problems within that physiology. You know, historically and theoretically, it would be using things like natural remedies and so forth to achieve that. But I think it's really, you know, over time and the evolution of the practice and profession, it's grown way beyond that. Okay. So we use things like you need to use things like herbal medicine or supplementation, manipulation, physical medicine, but we also use conventional medicines when needed as well.
Okay, and that's perfect because what we're talking about today is complementary or integrative health. So can you explain what that is?
You know, so I would say that complementary medicine is probably defined a little bit differently than alternative medicine by definition. You know, complementary medicine would be using your medicine to, well, complement another form of medicine. So, you know, an example would be with Dr. Larson. If he and I would be co-managing a patient, he would be using his methods of treatment and I might be encouraging my methods and working together. So that would be complementary. And there's other models within our healthcare system that are models for that. And I would say alternative medicine is something different. It would be using an alternative approach for a same problem, but would be completely different approach than, let's say, something that a medical doctor might offer. Okay. So I think it's either working in conjunction with or separate from in terms of that definition.
Are there a lot of people that use complementary medicine?
You know, I would say more and more people. I know that in my practice we get many people who come in for regular care, but we also get people who come in because they've seen a conventional provider, a medical doctor, and they might be looking for a different answer, or they might be looking for a way to maybe improve the efficacy of the care that they're already getting, or might be just looking for some other solutions or ways to approach a problem.
Okay, so it sounds like complementary medicine still involves a medical doctor. So Dr. Larson, could we talk a little bit about how a patient might use a complementary medicine approach to their health care?
Sure. It kind of depends on what their underlying health belief system is. There are times where, despite all our best treatments in traditional medicine, we cannot improve the symptoms that the patient has been having for such a long time. Pain is often one of the difficult medical problems that we deal with, and there are times where alternative medicine, complementary medicine, can afford them pain relief that traditional medicine does not.
Okay, great. So if a person wants to get some information about how to do a complementary medicine approach, Dr. Rausch, maybe you could take that one. Where would they start?
Well, I think in my opinion, they would come and see a licensed naturopathic physician would be one place to start. And first and foremost, I would say that not every naturopath might have a tool that the patient might be looking for. An example might be acupuncture or yoga or what have you. But what I would say is that a licensed naturopath, especially in this particular state, I think has good information regarding the efficacy of certain treatments that have been studied and know what's potentially safe. And they also can tell you potentially what are some interactions or some side effects, and or how might that interact with their conventional treatment. So you want to find somebody who's qualified.
Perfect. All right, and then Dr. Larson, do conventional medical providers or Western medicine providers, do they work a lot with naturopathic doctors? What's the relationship like there?
It depends on what their underlying belief system is in regards to medicine. There are some physicians who only practice Western style medicine. They don't feel that complementary medicine has a role in treatment. And other providers who are more open to alternative treatment and complementary treatment because it does help the patient with their symptoms and quality of life.
Okay. So for some people watching right now, this might be the first time they've even ever heard of complementary or integrative medicine. Would you say it's safe? What would you tell people watching?
Go ahead.
Yes, I typically find that it's safe.
Okay. Short and sweet?
Yeah, I would say that the misnomer that I think I would want to clear up is that people think that that if it's natural, that it has to be safe. And I would say that's probably not completely true, that we would still want to make sure that they're talking to a qualified health professional about their choices and what they're looking at. I mean, certainly there are some that are absolutely safe, but others, they might need some more information from somebody. And I would encourage them to either ask their naturopathic physician or their medical doctor.
Okay, great. That's good advice. We're almost out of time, but I think something else that people would be interested to know, health insurance, does it cover naturopathic medicine?
That's growing. I would say most private, there are some laws in this state and also nationally that require third-party payers to cover this profession. I would also say, though, that most federal plans, Medicare, Medicaid, does not. So it really depends on the coverage and the state, et cetera, in which the person's practicing.
Okay, perfect. Thank you for that. We do need to take a break, but we'll be right back to talk more about complementary medicine after these messages. Stay with us.